We've gotten away from that. It's all about the individual. Do what's right for you. I feel better when I drink a lot of alcohol, people say. Yeah, especially these days. I feel better when I smoke a carton of cigarettes a day, some people will tell me. Okay. I'm all for your right to do that. But you've got to pay a higher price to do it. Why should somebody that doesn't smoke and someone that does smoke, and it's fine that they smoke, but why should you pay the same insurance rate? If I skydive, I pay a higher insurance rate. Point of fact. Now, many people say, well, you know, Dave, you're big into educating people and putting the facts out there and letting them decide about what they should do or shouldn't do. I don't know if that works with alcohol or smoking or any of this stuff. I go, really? Why don't we look at firearms injuries? You know, about 15 years ago, we were taking care of a lot of kids who were finding their mom and dad's gun in their house, and it wasn't secured properly, and they were shooting themselves, or shooting their friends, or shooting their brothers or sisters, and the fatality rates were really alarming. So in our work in prevention, we went to the NRA, and we said, you know, this is a huge problem. And they said, show us the numbers, and we did. And then they said, what do we do? I go, educate your members. And they did. And guess what happened? Firearms injuries plummeted. Fatalities plummeted. And here's what I've found over the years with our prevention work. You educate one mom in a community about how to make that ball field safer, or that hockey rink safer. In 1 month, I will show you a safer community. People are hungry for knowledge. And one of the big problems I find in our country is we're continually told, you're one person and you can't make a difference. Don't bother trying. Don't buy into that loser mentality. Those are just the big boys, the status quo boys, that are making gazillion bucks the way the system is now. They don't want you to be an individual. No. You see, this is about empowerment. And the first part of empowerment comes with the facts and with being educated. So when folks say, you know, you probably can't do stuff about this, let me tell you something. We're going to talk about how, from a financial standpoint, to get these folks on board. One of the things we need to do is we need to decrease the health care coverage requirements by states. Now, what do we mean by that? Every single one of us that has health insurance, the state mandates that certain conditions must be covered. Cancer, heart disease, you know, that kind of stuff. But then there's a bunch of other stuff that's in there. And all it does is boost up our premiums on stuff we're never going to use. What do I mean? Well, look at the numbers. In 1970, the state said 48 separate entities have to be covered. Now, that's not like 10 types of cancer and 4 types of, it's like heart disease is one, cancer is one, diabetes is one. I mean, so big entities, 48. By 1990, that got up to be 1,000. By 2009, it went up to over 2,130. In 2010, it's over 2,200 entities have to be covered. Well, you'll be interested to know that I looked at my insurance policy, and I am currently paying for obstetric and gynecological services for myself. And my wife is paying for prostate-related issues that could develop. It's true of all of us. So when I talk about, wait a minute, let's take it from here and like kind of back to the future kind of thing, let's go back to 48 entities, it would cut our insurance premiums by about 75%. So who do you think's against it? Yeah, the big boys in the insurance industry. They hate this. Tort reform. Mistakes happen in medicine. And when they occur, the person that has the injury sustained should be compensated fairly. Right now, that's not happening. In the current version of Obamacare, there is no tort reform. It's not surprising, come on. I mean, he's an attorney, she's an attorney. Howard Dean, the chairman of the Democratic Party, came out and said, what do you think? You think we're really going to do this? I mean, we get huge amounts of money from the Trial Lawyers Association. And one of the underlying themes, and I know this sounds pessimistic, but it's the truth that I've learned over all the years, is you just follow the money many times and you get to why currently things are happening. So here's the bottom line. There are states like Indiana that set up arbitration boards. And if you believe you're harmed by medical malpractice, you get representation, and the doc gets representation, you go in front of the arbitration panel and you hammer it out. Here's the other good part. Some people take offense to this. Legal fees. This business where Jeffrey Feiger's walking away with bags of gold in his pocket while his client is still destitute stops. Let the person that was injured get reimbursed, get paid, get compensated, but not the hack that filed the suit. They should get paid, but fairly. The other option on this, loser pays. You file an erroneous lawsuit, bring it. But if you're found that it's erroneous, then you pay. Not only your legal fees, but the docs who got misrepresented in this. Now, we're not saying all the malpractice claims have to go away. No, not at all. But we need to modify it because those costs that have been estimated in the hundreds of billions of dollars are passed on to every one of us. Oh, the Gov loves this. We need to make the FDA more streamlined. Now, whenever you start messing with the government and chopping out programs, you can imagine the hooey that happens. What do? First of all, the cost to bring a drug to market is $800 million, and it takes 8 to 10 years. To do that, the FDA proves it's safe and that it's efficacious, that it works. Now, wait a minute. If we just had them prove safety, but forget the efficacious side. I'm not going to prescribe something to my patients. Other docs aren't going to prescribe. If it doesn't work, there are hundreds of medical centers around this country that are doing great work on the efficacy of product. So why are we reduplicating it? If we did that and just had them do safety, you cut the approval process down to 2 years and you cut it from $800 million to $50 million. Okay, who do you think hates me on this other than the feds? The pharmaceutical industry. They hate me for this. Why? Because the bigger the barrier to entry, the less competition. If you take something and you say a drug can come to market at $50 million rather than $800 million, guess what? All of a sudden there's these small startup drug companies that start. So that's why the Pfizers and the Mercks and the you name it spend millions of dollars every year in lobbying efforts to keep this unchanged. Expenditures allocated to all providers, me, must be critically reviewed and based on outcome. When we talk to our patients, we tell them, if you're going to go with non-surgical treatment, the studies tell us this is going to be your chance of success. In my hands, if you have surgical treatment, this is your chance of success. There are a lot of docs that won't do this. Find another doc. We all know our results. We all do. If you have a doc that goes, well, I don't know, they're either telling you they've never taken care of the condition before, or they're lying to you. There are millions of docs, or at least hundreds of thousands of docs. My point, which we focus on, prevention-related research must be emphasized and become the foundation of reform. Just look at injury. The National Academy of Sciences have come out and said injury in America is the most under-recognized major public health problem facing our nation today. They issued that statement in 1988. 88. They reissued the same statement in 2009. Okay. If you just look at the injury statistics, it's the single greatest killer of folks age 1 to 44. We spend $150 billion on injuries per year. That doesn't include the time lost from work. 62 million Americans will seek health care related to injuries. But here's the good news. The vast majority of those injuries are completely preventable. So wait a minute. If they're completely preventable, if we can save at least $150 billion a year, why did they issue the statement in 88 and the same statement in 2009? I could give you a lot of diplomatic answers. As we've already identified, I'm not a diplomat. Here's the answer. There's no money in prevention. Zero. Zero. Let me give you an example. A number of months ago, I was asked to lecture to 30 medical school deans in our country, very prestigious medical schools. I was introduced, not as nice as Bridges, and as I was walking up to the podium, one of the deans stood up and goes, I don't understand why we're going to hear Janda talk about prevention, because let's face it, we're never going to teach this in our medical schools. And he looked around the other 29 deans, and nobody said anything. He goes, that's right. And he looks at me, he goes, Janda, you should know better than anybody. You've been doing this close to 20 years. He goes, you know, there isn't any money in it. So what do? Well, from Chicago, Ben and Ruth Janda's kid, not a diplomat. So I looked at him and I said, Doc, you and I both took an oath when we became physicians. And that oath was to do no harm. And all I'm trying to do is extend that oath to prevent harm. Why do you find that so onerous? And he looked at me and was kind of flabbergasted I would say something to a dean of a prestigious medical school. But I didn't stop there, and I looked at him and I said, you know, when I was a very young boy, my parents taught me that there are times in your life you need to be quiet, you need to listen, and you need to learn. And doctor, that day has come for you. He sat down. He listened. I'm not sure he learned. After that event, every other dean came up to me and said, yeah, you know, he was out of line and we really support you. And I go, where were you? There was nobody that stood up when he said that. And that's the problem in medicine today. The leadership isn't there. They're worried about what the guys that hang out in that big dome in Washington say. They care more about what the big guy in the White House cares about. And they're not caring about you. That's the state of medicine today. That's what needs to change. So my point, we need to make doctors more accountable to each and every person in this room. So how do we do it? Well, a friend of mine says, you know, Dave, man, this is like an uphill battle, huge uphill. This is Everest, because form follows finance. And the truth of the matter is we're spending 3% a year on prevention, the most effective way of cutting costs, and we're spending 32% on non-healthcare related services. What does that mean? 32% on administration. And he goes, and these are the folks that have all day to kind of plot and plan and get things done, while you're trying to grind it out, seeing patients take care of them. That's what you're up against. So let's talk. We're in Detroit. We used to make vehicles in the city. Let's talk about what the vehicle is. To make doctors more accountable. To get insurance companies, HMOs, and federal bureaucrats out of our lives. To empower each person in this room and not them. And here it is. Health savings accounts. What are they? Individuals set aside a portion of their earnings in a tax-free investment account, like a medical, essentially like an IRA. Think of it as a medical IRA. From those accounts, the individual pays for the smaller medical bills, leaving a high-deductible, low-premium insurance to cover the high-cost items.